Want to know if there were problems in our doctor's past, like making mistakes that caused someone their life. That's exactly what led one woman to lead the fight for Colorado's medical transparency law.
I love you. His dad was sitting at his head and he died. And it was like, this all shouldn't have happened.
Parents always want the best of the best for their children, just like the parents of Michael Skolnik, a 22-year-old nursing student who dreamt of achieving something big in his life. However, it wasn't known to anyone that his life was going to be cut short and he will soon pass away. But what really happened to Michael? His story will shock you to the core. The last regular day of Michael's life began as usual. He was seated on the couch, playing with his family's new puppy. Suddenly, he passed out. When Michael returned to consciousness, the 22-year-old EMT and nursing student realized he needed to be transported to the medical room straight away. At the time, a doctor suggested that Michael had suffered a seizure as a side effect of Wellbutrin, an antidepressant he was taking to quit smoking. However, a CT scan later revealed a 3mm dot in his brain. The Skolniks believed that the neurosurgeon made a quick and deadly rush to judgment. According to the Skolniks, it was that quick and deadly judgment of the neurosurgeon that led to Michael's death. He cautioned Michael that he was lucky to have survived his first seizure and that he needed surgery right away. But who knew the surgery was going to cost Michael his life? According to Patty, Michael's mother, the doctor suggested to them that it was going to be an easy procedure and that they don't need to be worried about it at all. He said, "It's a very simple operation," Patty recalls the doctor saying. "All I do is go in and remove the cyst." However, it was soon realized by Michael's parents that they had made a huge mistake that was soon going to give them a devastating blow. According to the Skolniks, the doctor claimed to have conducted numerous such surgeries, but later revealed in a legal deposition that Michael's procedure was only his second. Whatever the case, no cyst was excised or discovered. A hard 3-hour operation concluded 6 hours later, and Michael was never the same. Other doctors have now told the Skolniks that, at most, a shunt should have been inserted in Michael's brain and that the elusive dot was most likely harmless. According to several specialists, the seizure was most likely caused by a severe reaction to Wellbutrin. But it was too late to realize all of that. The Skolniks become clearly enraged when they tell how the neurosurgeon announced Michael's prognosis following the disastrous surgery. He pulled back his hat and said, "I've had the worst year." David, Michael's father, recalls angrily, "We were a family that made decisions together. This changed who we are. It was our life forever with Michael. Now it's still our life, but without Michael." The family's 32-month ordeal included numerous surgeries, systemic infections, deep vein thrombosis, pulmonary embolism, DIC, and sepsis. Michael developed paralysis, psychosis, respiratory arrest, and an endocrine system failure, causing him to gain over 100 pounds. He was partially blind and couldn't speak. He was fed through a tube in his stomach. Michael's health deteriorated significantly as a result of the surgery, eventually leading to his death. Michael died on June 4, 2004, after looking into his father's eyes and mouthing, "I love you." The neurosurgeon, who would later establish a now-closed medical practice at Western Plains Neurosurgery in Scottsbluff, Nebraska, has been unavailable for comment to the press. He reportedly still lives in the Denver area and plans to open a new practice in Glenwood Springs, but Michael was gone. According to his parents, Michael was the sweetest and the most lively human being. On one of the days in April 1986, when Michael was 7 years old, he did one of the funniest things with his mother that is still being remembered by Patty Skolnik. Michael Skolnik was up to his usual tricks, but this time he was armed with a convenient little alibi called April Fool's Day. The mischievous child was slowly creeping up behind his unsuspecting mother when all of a sudden, crack! A perfect shot, over and easy. A broken egg scrambled on Patty's face. He just thought it was the funniest thing he had ever done, Patty recalled, as a glow quickly covered her face. "My first reaction was, 'What have you done?' But then, you had to laugh because Michael just made you laugh. He was such a character, she said with a little laugh. But the laugh comes as easy as tears when Patty talks about her only child. She hopes that one day, after she is gone to the eternal place, she will be able to see and meet with her child again. Your life is forever changed, and you hope there is something after death so you can believe you will see your child again, said Patty. She also remembered one of the times in Michael's life when he was 13 and he didn't believe that there existed any God. However, with Patty's one question, it changed his life forever. What do you think God will feel if you die and discover there is a God? Patty asked her son at the time. Well, if God is supposed to be all-forgiving, he'll forgive me for not believing in him, the young adolescent responded. But what had happened to Michael afterwards? It can be said that God must have forgiven him. Patty has remembered this interaction for almost a decade, and she thinks that this was pretty serious for a 13-year-old. She also added that she always feels Michael is right there behind her, pushing her all along. So did Michael's death make any move? Surely, yes. After Michael died, his case was investigated, and while the neurosurgeon's actions were determined to be within the standards of care, Skolnik believes that the choice to undergo surgery was rushed in the chaotic hours following his seizure. She believes Michael and his family were not told of all the options, including the option not to have surgery. This tragedy inspired Skolnik's patient advocacy efforts. She has testified in the state capitol, worked on legislation to promote healthcare openness, and created public service announcements about patient rights. Skolnik's work for Citizens for Patient Safety, an organization she started in 2005 to increase patient health knowledge and empowerment, includes visits to medical campuses across the country. Not only that, it also led to the Michael Skolnik Medical Transparency Act of 2010 was also established after Michael Skolnik's tragic death. Since at the time, Michael's family was not aware of the physician's inexperience and previous cases. If they had known about the physician's history, they would have chosen a different doctor. As a result of their struggle, Michael's mother advocated for legislation that became known as the Michael Skolnik Medical Transparency Act in order to promote patient advocacy and transparency. The Transparency Act, also known as CRS 2434-110, requires healthcare professionals applying for a license, certification, or registration to disclose any public disciplinary actions, practice restrictions or suspensions, and any action that results in probation, non-renewal, or revocation of clinical privileges. But Patty did something else as well. A year after Michael died, Skolnik fulfilled her commitment to her son by establishing Citizens for Patient Safety, also known as CPS, to strengthen shared decision-making between patients and physicians. Educating medical students, residents, and practicing physicians on how to obtain properly informed consent when treating patients is an important component of CPS's work. CPS workshops provide training to guarantee that the patient and doctor discuss the risks, advantages, and alternatives to the procedure, as well as the option of receiving no treatment at all. They also teach doctors how to listen and ensure that the patient understands what is going on before consenting to the surgery. While informed consent is commonly associated with surgery and other high-risk procedures, all medical decisions requires a patient's consent. There is scant evidence on the particular links between informed consent and patient outcomes, but research has shown that effective patient-provider communication is connected with better outcomes for both doctor and patient. Nonetheless, research indicates that significant gaps in getting patient consent persist. For example, a 2013 report from the Agency for Healthcare Research and Quality highlighted research indicating that just 9% of over 1,000 outpatient interactions analyzed had all the criteria of informed decision-making. The most common medical oversight was not assessing the patient's comprehension of the material. The survey also stated that reading levels for informed consent forms are frequently excessively high, and that most patients are unable to properly recall what they have agreed to. But with the Transparency Act and the CPS model, these issues are now assumed to be coming to an end. Let us know what your thoughts are on this in the comments below. Also, don't forget to subscribe to the channel if you want to stay updated about more such videos. See you in the next one.